So let's proceed with our questions. Heading blood supply to the central nervous system. A 30-year-old boy is hit on the temple with a basketball and becomes unconscious. After about 10 minutes, he regains consciousness, but he soon becomes lethargic. And over the next 2 hours, he becomes stuporous. His pupils are unequal. Intracranial hemorrhage is suspected. Look at that, intracranial hemorrhage is suspected. Which of the following vessels is most likely to be the source of the hemorrhage? Anterior cerebral, basilar, middle cerebral, middle meningeal. What do you think? Any thought? Okay, very good. So if someone is hit on the, remember where they've been hit. Okay, they have been hit on the temple. It is on the temporal bone that you find what we call the terion, where the four bones meet, and that area is a weak area because inside there is the middle meningeal artery. So if you hit that area, there's going to be the subdural hemorrhage. And that hemorrhage, you can become unconscious, you can regain consciousness and become stuporous. All right. Next, a 70-year-old hypertensive woman complains of numbness and weakness in her left leg and foot. Occlusion of which of the following vessels may account for this complaint? Remember, in the left leg and foot, anterior choroidal, anterior cerebral, in, interior, internal carotid, and middle cerebral. Any thought? Any thought? Anterior cerebral, excellent. Remember, anterior cerebral supplies the medial part of the brain which controls the legs, all right? Regarding the blood supply to the internal capsule, recurrent artery of Hebner supplies mainly the posterior and retrolentiform part. Striate artery of middle cerebral supplies anterior and posterior limbs and genu. Striate artery of the anterior cerebral artery supplies the posterior limb. Anterior choroidal artery supplies the anterior limb. What do you think here? Any thought? So this is a picture here. So you can see the anterior recurrent artery of Hebner only supplies the anterior limb and the genu. Okay. The striate branches only supply the anterior limb, and then a direct branch from the internal carotid only supply the genu. The middle cerebral supplies three parts. Same with the posterior cerebral supplies three parts. Middle cerebral supply the anterior limb, the genu, and the posterior limb, while the posterior cerebral supply the posterior limb, sublentiform, and retrolentiform. Anterior colloidal supplies two parts, supplies the posterior limb and the sublentiform. Okay. So if you can see, anterior choroid supplies the anterior limb and genu. That's not true. Straight artery of the anterior cerebral artery supplies the posterior limb. Straight artery of the middle cerebral. So the answer here is anterior choroid supplies anterior limb. Look at this picture. Anterior choroid is there. Okay, again, so that comma option is not even correct. It's supposed to be posterior limb and the sublentiform. This option is saying anterior limb and genu. That is not true of the anterior choroidal. So this is out. A is saying recurrent artery of Hebner supplies mainly the posterior and retrolentiform. That's not true, isn't it? B is saying striate artery of middle cerebral supplies anterior limb, posterior limb, and genu. So B is the correct answer for this one. Okay, it's the striate artery of the middle cerebral, this one, which supply the three parts: anterior limb, genu, and the posterior limb. Hope that's okay. Is that okay? Excellent. Okay. Next, about the blood supply to the cerebellum, posterior and inferior cerebellar artery is a branch of the vertebral artery. Superior cerebellar artery is a branch of the posterior cerebellar artery, cerebral artery. Anterior inferior cerebellar artery is a branch of the anterior cerebral artery. Lateral medullary syndrome is caused by blockade or in ICA. What do you think? Any thought? Let's start with option A. Posterior inferior cerebellar artery is a branch of the vertebral artery. Is that true? Pica comes from vertebral artery. Okay, that's true. Okay, so that's actually the answer. If one is an answer, the others can't be answered. Superior cerebellar is a branch of the posterior cerebral. Superior cerebellar comes from the basilar. Okay, and then anterior inferior is a branch of anterior cerebral. Anterior inferior also comes from the basilar. Lateral medullary syndrome is caused by pica occlusion and not ICA. Okay. Which fold of dura mater encloses the superior petrosal sinus? Falx cerebelli, falx cerebri, tentorium cerebelli, diaphragm, diaphragma celli. What do you think? Now the superior petrosal is down to be covered by the tentorium cerebelli because that's a 10 touch down. Regarding the blood supply to the internal capsule, recurrent arterial fibrin supplies mainly the posterior and the, okay, we answered this already, isn't it? And we said the answer is B. The optic chiasm is supplied by the following arteries except internal carotid, anterior communicating, anterior choroidal, posterior communicating. What do you think? The optic chiasm is where the arteriosacral fluid is forms. So the exception is the anterior choroidal to be supplied by other branches like the internal carotid itself, the anterior communicating, posterior communicating, anterior cerebral, posterior cerebral, even the basilar, but not anterior choroid. Which of the following artery supplies Broca's area? ACA, MCA, PCA, lateral striate, anterior communicating. Any thought for this one? Broca's area. Sorry, again? Okay. So remember Broca's area is found in the frontal lobe. So that is going to be supplied by is supplied by the middle cerebral. That's why when there is injury to the middle cerebral, there's going to be aphasia. Both Broca's aphasia and Wernicke's aphasia. Okay. All the following are intracranial hematomas except cephalohematoma, subdural hematoma, subarachnoid hematoma, epidural hematoma. What do you think for this one? So we talked about subdural, subarachnoid, and epidural. Okay. So cephalohematoma is not part. This one is a subperitoneal hemorrhage that occurs between the skull and the periosteum. Okay, it's on top. It's not intracranial. A 50-year-old hypertensive woman complains of numbness and weakness in her left leg and foot. Okay, we already answered this one. A 15-year-old boy is hit on the temple. Also answered that. Which artery supplies the caudate and putamen and the anterior limb of the internal capsule via the medial striate artery of Hebner? Okay. Anterior cerebral, anterior choroidal, anterior communicating, middle cerebral, posterior communicating. Any thought? Would you say that again? Okay. Thank you. So remember the recurrent artery of Hebner comes from the anterior cerebral, so that will be the one. Which artery supplies the cochlea? Remember the cochlea is the hearing part of the ear. Anterior inferior cerebellar, labyrinthine, pontine, posterior cerebral, superior cerebellar. Any thought there? Okay, excellent. Labyrinthine. Occlusion of the left middle cerebral artery can produce the following. Remember, left middle cerebral. It has even specified this what? Left. So it will produce the following except ipsilateral deafness, like deafness on the same side, aplasia, contralateral hemiparesis and hemisensory loss of the face and arm, change in pesentory, agravia, and alexia. Just some medical terms that have been used here. Remember, the left middle cerebral supply the left side of the brain, so anything to do with the Broca's area or Nick's area is going to be affected, and then the other side of the body is going to become weak. Okay, so ipsilateral deafness is not true, but there's going to be contralateral hemiparesis on the other side, and there's also going to be aphasia. There's also going to be agraphia and alexia. These are language deficits. Okay, because of the angular gyrus that is part of those that control language. And there's going to be changes in perception and cognition. Perception and cognition. So that is that. This is supposed to be aphasia, not aplasia. So the answer is ipsilateral deafness. Okay. Deafness is not a typical feature when there's injury to the mid cerebrum. Which of the following statement regarding to the intracranial blood circulation is correct? Posterior communication normally carries blood from the internal carotid to the posterior cerebral. Occlusion of the labyrinthine in the artery can cause vertigo. Vertigo, this is where you are like spinning, you feel like you're spinning. The two arterial cerebral arteries may arise by a common stem. Bleeding from an aneurysm in the cerebral cause subdural hemorrhage. The anterior communicating connects the anterior and middle cerebral artery. Any thought? Any thought here? Look at A. Posterior communicating normally carries blood from the internal carotid. Now, posterior communicating, yes, right? Is part of the internal carotid. Occlusion of the labyrinthine can cause vertigo. Now, vertigo is a problem with the vestibular system. Labyrinthine, I said the internal ear contains the vestibular part and the auditory part. Okay. The auditory part supplies what? Is supplied by the labyrinthine, but the balance, the vestibular part, is not supplied. So that's why that option is correct. Is not correct. Okay, vertigo is a problem of balance, and that's not supplied by the labyrinthine. Two arterial cerebral artery may arise by a common stem. Anterior cerebral artery. Two anterior cerebral artery may arise by a common stem. Because whatever they were meaning, bleeding from an aneurysm in the cerebral causes subdural hemorrhage, not subdural. This is going to be intracranial inside. The anterior communication connects the anterior and middle cerebral. Anterior communication will only connect the anterior cerebral arteries, right? So the answer is posterior communication normally carries blood from the internal carotid. So that is the answer. Which of the following statements regarding to the posterior cerebral artery correct? Which of the following statement regarding the posterior cerebral artery is correct? Posterior cerebral. Its blockage can cause contralateral blindness. Its choroidal branch supplies the choroid plexus. Its central branches pass through the posterior perforated substance to supply parts of the thalamus and lentiform nucleus. It also supplies the choroid plexus. It is always a branch of the basilar artery. So posterior cerebral, remember, yes, it comes from the basilar artery. Its blockade can cause contralateral blindness. Okay, that's not really false, but the most correct is its branch is always it's always a branch of the basilar, because posterior cerebral, that's where it comes from, right? For the other one, its blockage can cause contralateral blindness, is partially correct, but it can also cause homonymous hemianopia, not complete contralateral blindness. Homonymous hemianopia is, we'll discuss this later, you understand. This is where you have lost sight on on one side of the eye. So for one eye, you can't only see, let's say, the left part. And then for the other eye, you also can't see only the left part. For now, you might not really get it much, but you understand later on. Which of the following statements regarding to the anterior choroidal artery is correct? Branch of anterior cerebral artery. It is of wide cut Breer and hence rarely thrombosis. It anastomoses with posterior choroidal artery, which is a branch of the middle cerebral artery. Supplies the hippocampus formation. The thrombosis causes ipsilateral blindness. Anterior choroidal, the guy who supply the hippocampal formation, okay, to supply the hippocampus. You know, this guy comes from it comes from the internal carotid. If you look at the picture, it goes a bit behind posterior. Cortical branches of the anterior cerebral artery can cause or except cortical branches, those are supplying the cortex. So a cortical branch of the anterior cerebral. Contralateral face weakness without sensory loss, paralysis and sensory deficit of the contralateral leg, behavior and cognitive abnormalities, memory and emotional disturbance, disorder of sphincter control. Now, contralateral face weakness without sensory loss. The anterior cerebral supplies the medial portion of the frontal and parietal lobes, and these ones control motor and sensory function of the lower limb, right? Motor and sensory. So occlusion will lead to contralateral leg weakness, behavior and cognitive change because the frontal lobe is involved, memory and emotional disturbance because part of that is the limbic system is involved, which controls memory and emotion, and then sphincter because there's what is known as the paracentral lobule. So this controls, in other words, the brain will be controlling these sphincters, okay, also. So that is going to also cause loss of control of the sphincters, okay. But contralateral face weakness, this one is not true because the face is not actually controlled by anterior cerebral. This one controls the down part. Then the last question, draw a well labeled diagram of the arterial circle of Willis. So this one you are going to draw. This is what came in test 1. In the final exam in 2024, they brought the arterial circle of Willis to label. So if they bring for you in the test to draw, it might bring for you to label. So this time likely they are going to bring something that is labeled for you to label instead of drawing. Probably in the exam that's where they ask you to draw. But both of them, please just know. Okay.